Omicron is dominating the outbreak in quite a number of countries worldwide. Korea is no exception, with its daily tally having surpassed the 10,000 mark this week. For more on the COVID-19 situation here and elsewhere, I have Professor Kim Min-gyu from Yonsei University. Professor Kim, welcome back.
Thank you for having me.
I also have Dr. Kim Seung-taek from Institute Pasteur Korea. Dr. Kim, welcome back as well.
Good afternoon.
Meanwhile, joining the session virtually is Dr. Amitabh Arya at the Sanjay Gandhi Postgraduate Institute of Medical Sciences. Dr. Arya, it's a pleasure to have you back.
안녕하세요.
Right, Professor Kim, we'll start here. A range of different forecasts are being made with regard to our daily tally in the days ahead, with authorities claiming that the tally could hit as high as 30,000. What is your forecast?
Well, I'm not good in expecting those numbers, but with caution, I think that it will be more than 30,000, but hopefully less than that big number, 200,000 or something. Always we have to think about three factors when this kind of pandemic happens. The first one is the virus factor. Second one is the government factor, giving out policies. And the third factor is the humans, I mean the general population. But before we speak more, now many things have changed. We used to focus on the total count of the confirmed cases. Now we want to focus more on severe cases. And in the aspect of this focus on severe cases, we have to think about the virus. And this Omicron has a less case fatality. In Korea, we used to have 0.8 fatality for Delta variant, and right now the Omicron seems to be less than that, about 0.16%. That's good. And the government factor, we have only the number of severe cases, but I wish that we have more information about them. I mean, more detailed information, how severe are they and what is their vaccine status and when they got vaccinated and how many times they got it. If you understand that, the general population will understand what they have to do. And the third factor, humans. I mean, it's all developing very fast, and some people have low credibility on vaccines after the emergence of Delta and Omicron. So I see that the severe cases are decreasing day by day, but it's the number that is decreasing is almost the same number with fatalities. That means if you become severe case, there's not much high chance you're going to survive. So that means prevention is very important. So let the people understand about the situation, and at least that will help to overcome this Omicron outbreak.
Right, I see. Dr. Arya, over in India, I hear Omicron infections have been retreating in large cities like New Delhi and Mumbai, and officials are now seeking to stem the spread in smaller towns. Do you suppose the worst of the Omicron wave in India is over?
It is receding now. Actually, we were thinking that in March we'll have a peak, but the way the cases have come so rapidly, I think in February we should peak and then the cases will go down further.
Right, so you have yet to witness a peak then?
Yeah.
Dr. Arya, most of the cases in India with regard to Omicron are mild infections, would you say?
It's a mild infection. Actually, I also got infected with Omicron recently. I joined on Monday. My entire family was infected due to me. It was like a mild flu, mild body ache, mild fever. And no serious problems. In fact, many of the doctors in my institute, this time, they were luckily safe in the Delta variant, but this time in Omicron, if one resident in the department got infected, almost every one of them got infected. Luckily, nobody needed any oxygen or any admission in the hospital, and all of them recovered within a week.
I see. It's good to know you're back, Dr. Arya, then.
Yes.
Dr. Kim, there is cautious optimism that Omicron, an Omicron-fueled surge that is, will be short-lived and will facilitate a transition into an endemic state of COVID-19. But some claim that this is not the case or may not be the case for Korea. Do you care to elaborate?
Well, the countries like the US and the European countries, they actually experience, or are still just experiencing this large number of just infections. probably just more than 100,000 cases. And then this is quite just explosive infection case right now. But the situation in Korea might be just a little bit different because I think just a major reason is that our Korean society is that our quarantine is pretty just much better than the conditions in the other countries. So then in other countries, they actually experience the sharp peak over a very short period of time. But if in our case, if our just quarantine procedure is still just successful, we might just experience very broad distribution of some Omicron infection for relatively just a longer period of time. So that might be just one of probably the differences we might just experience. As long as we actually imagine some same number of infection cases for this Omicron variant, and also our vaccination rate is pretty higher than those countries, and especially also some booster shot. And then once we actually consider the booster shots for especially for some vulnerable people, including some elderly people, maybe we might just experience a less number of severe cases of COVID-19 as well.
Right, hopefully that will be the case. Dr. Arya, do tell us a bit about some of the containment measures adopted by authorities in India to fight Omicron, and how effective have they been?
It has been very effective because most of the offices, especially the private ones, corporate ones, they are still having that work from home. And regarding the government facilities, they have asked for 50% of their staff to come, and rest they can work from home. These restrictions definitely have done a lot of control on this Omicron variant. If we compare with the previous variant, definitely this time the authorities have done their job well. Last time people took it very casually, but this time people are also following the rules much better than the previous Delta variant wave.
Right.
So definitely these measures have definitely led to the lesser spread of the disease.
Right, I see. And staying with containment efforts, Professor Kim, do you suppose Korea needs to strengthen its restrictions in response to this latest resurgence?
If I name the quarantine measures we embraced since now as a version 1.0, now this version 1.0 is used to be effective against original Wuhan strain, but less effective on Delta variant. There's a recent article on mortality morbidity monthly report that includes more than 1 million people from California and New York. And after the emergence of Delta variant, the vaccinated group without previous infection had a sharp rise in COVID-19, but not in the people previously infected with COVID-19, whether they got vaccinated or not. So that means infection-derived protection was greater after Delta variant. But vaccine is still effective preventing hospitalization. And this data is before Omicron, so we don't know about Omicron yet. I hope that this follow-up study will show up soon. So if we apply the same 1.0 version for Omicron, we are going to be limited. We're going to be disappointed because it's going to have only limited effects. So if we strengthen our quarantine measures, I think it should be focused on the risk group, high-risk group, to protect them. Otherwise, still we're going to have a high rise of severe cases in the future. So about outdoor activity, I think we can loosen some measures, and if you keep few meters from each other, the need for a mask is going to be lower. But about indoor spaces, we still have to wear masks, and when you're eating or drinking in a confined place, you should be very cautious, especially for risk group. And the toilet is a constant problem for spreading infections. So disinfecting those areas frequently is going to be needed.
Right, it will be a priority then, of course. Dr. Kim, recent reports show that those who got their booster shots are 90% less likely to be hospitalized. And in response to that, some US health experts are claiming that the term fully vaccinated needs to include a third shot. What are your thoughts on this?
Well, the effect of the booster shot is now just well documented from the many just studies from all over the world. And then including the third shot, the booster shot as some basic just vaccine schedule. Well, it's not really just not unusual. We actually have such kind of the 3-shot program is, for example, like hepatitis B vaccination. And then it's earlier just a pandemic, where we actually did not have enough time to just try all different kinds of just a vaccination schedule. For that time, because the purpose was that just distributing just the vaccine as soon as possible was just the number one priority. So most of the vaccine companies actually tried the 3 or 4 week just interval schedule between just the first shot and the second shot. And the second shot, the efficacy was just remarkable. So then they just distributed all the vaccines. But now, since then, some data is just has been just accumulated, and then the effect of booster shot is well documented. And especially if I just distinguish the antibody response and the T cell responses, I think still many scientists believe that the T cell response is still just pretty good after the second shot. But for the antibody response is, I think some breadth of immune response is just improved after the booster shot, and then increasing the interval between the shot is has been known for a long time to just increase the quality of the immune response in our body. So the reason for the 3 to 4 weeks of interval in the first vaccine was that just because of just emergency cases. But as just more the data is accumulated, we might have just a better understanding of why more just a longer interval is important, or also just some third shot is also so beneficial, or compared to the some 2-shot program.
Right, and staying with booster shots, Dr. Kim, more than 50% of Korea's population, just above 50%, that is, of the Korean population, has received a 3rd dose, as mentioned by my colleague earlier on. How do you assess the pace of our booster campaign?
I think it's pretty good, and then I think the most of the group of people will get the most benefit by the booster shot is actually high-risk groups, mostly some elderly people and then also immune-compromised people. And actually last December, one of the reasons that Korea has actually suffered many numbers of large numbers of severe COVID-19 patients is that we actually had some very good expectation, but the severe cases increased because the cases actually reported mostly some elderly people and is residing in some nursing home and then the nursing hospitals, and that those people, although they finished the 2-shot programs, after some waning immunity, they were became more vulnerable to those things, and then these people are basically had underlying medical condition, and then immune, they're very weak immunity, so then they were vulnerable. But I think most of the elderly people got I think more than 85% of those people got the booster shot. Now I think they are now more better prepared for the Omicron variant than others.
Right. And Dr. Arya, the WHO has asserted that 70% of each country's population needs to be fully vaccinated to end this state of global emergency. Now, having said that, where does India's inoculation campaign stand, and how feasible is the global health body's assertion?
In India, as per data, 1.62 billion individuals have been vaccinated, out of which 68% have been fully vaccinated and 91% have got 1 dose of the vaccine. And we are having booster doses as well for many patients, many individuals who have been fully vaccinated. So the vaccination program is going on very well, and those who have been fully vaccinated, they are getting booster doses also. And now the children from 15 to 18 also are being vaccinated as per the new program of the government of India. And very soon we are going to have, once the trials are over, we'll be having vaccination for children younger than 15 years.
Right, I see. And Professor Kim, under Korea's Omicron strategy, PCR testing will be reserved for those aged 60 and above and those in high-risk groups, while the rest of the population will be offered the rapid antigen testing. What are your thoughts on the shift in COVID-19 screening method?
I would like to mention some merits and disadvantages of rapid antigen test. It's very simple. easy to do and you have a rapid result. But the critical shortcoming is not that sensitive enough. And it is useful when you got a positive result, but the negative result does not mean you are free of COVID-19. And it's going to cause a lot of confusion in general population. So how people is going to behave after they have a negative result? I think rapid antigen should be used after the capability of PCR test is all satisfied, and we might have to repeat the test next day or further for many reasons. If you have a new symptom, if the symptom does not subside, or if any people close by turned out to be positive, you might have to repeat that rapid test. And in hospital, I think we have to stay with PCR until the end of this pandemic.
Right. Dr. Kim, the isolation period for fully vaccinated COVID-19 patients has also been shortened to about a week, 7 days. What are your thoughts on the wisdom of this measure?
Well, there is some scientific evidence to just shorten this period of just isolation. And then, well, just for comparison, in actually US CDC, just based on, according to their just recent guidelines, their isolation period is just 5 days. But the Korea now, the 7 days, and then the basic just the scientific evidence for such kind of the decision is that most of the transmission occurs just 1 or 2 days before symptom onset, and then 2 or 3 days after the symptom. So the most of the transmission occurs those periods. So the decision is based on this number. So what I mean is that although most of the transmission occurs those periods, but there are some minor cases that transmission outside of this just a window. So there is some maybe some cautious. I mean the caution even after just finishing the isolation, that people, especially for the US, the CDC recommended just wearing masks for additional 5 days. For 5 days to just prevent the further potential transmission. And then this decision is actually based on the some current situation, because Omicron is so just contagious at this moment. So that if once any just for example, well, maybe 100,000 people are just infected. So then maybe including just family members, maybe we can just imagine 500,000 people can be isolated out of just total Korean population. In this case, maybe we might just experience a severe workforce, just a loss of workforce, including the policemen and the firefighters. So this is just actually reflecting the substantial socio-economic reasons just behind this the decision.
Right, to keep society from grinding to a halt, of course.
Sure. Right.
Dr. Arya, given your observations of India's campaign against Omicron, what would be your words of advice with regard to setting up a strategic response to Omicron, for example, here in Korea?
Like a recent study of Indian Council of Medical Research says that those who are infected with Omicron have a better immune response to neutralize the virus, including the Delta variant. And so finally, the Omicron variant is becoming the dominant variant now across the globe, and especially in India. So still, what I think, we need to still practice social distancing. We have to still wear masks, wash your hands properly, or if you don't have soap and water, please use alcohol-based sanitizers. And all of the people should get vaccinated fully. If not, they need to have a booster as well. And slowly, I think my take is by March, April, across the globe, the Omicron cases will come to respectably low levels. And I think this is the third year of this virus. I think we'll be overcoming this very soon.
Right, hopefully we will then. And Professor Kim, here in the studio, very briefly speaking, what are your words of advice to members of the public as we look ahead to the Lunar New Year holiday?
Well, there's no guarantee that Omicron is going to be the final variant in this pandemic. There's no guarantee that the future variant will cause mild symptoms. So I would like to mention briefly about the official statement from Korean Pediatric Society. As we know that the portion of pediatric cases is rising very fast, and we must prepare severe cases even in the pediatric age group. And the current healthcare system for COVID-19 is actually designed for adults. And already the pediatric departments are facing many difficulties because we have less manpower. And we have to keep all the quarantine measures for that infectious disease. There are not enough special wards for children and for caregivers. So if we have to transfer somebody to other hospital, it takes a very, very long time if they have other health issues. There is no enough pediatricians and nurses to care about them. And there are more issues about home care issues and outpatient department issues. So I wish that our government makes some clear plans to face that Omicron with increased pediatric cases.
Right. In the meantime, members of the public can be sure to follow Dr. Arya's thoughts about washing your hands, wearing your face mask, and watching your distance.
Yeah.
All right, Professor Kim, thank you very much for your thoughts.
Thank
Dr.
you.
Kim, thank you for being with us today. And Dr. Arya over in India, as always, thank you very much for your insights.
Kamsahamnida.